Patient profile is shifting. From healthier, more affluent patients who had been travelling, the virus is now taking hold in Cape Town's poorer communities. This is largely because many frontline staff live in informal settlements and densely populated areas.
So we've seen a significant spike in clusters, workplace-based clusters, supermarkets, police stations, which is to be expected in an epidemic where when everybody else is on lockdown. So the only people with legs, remember the virus doesn't have legs, so it needs people to move it from person to person. And the only people with legs at the moment are those who are working in essential services.
There are now more than 50 cases each in Mitchell's Plain and Khayelitsha, and also along the Klipfontein corridor. This is where some of the city's poorest suburbs are located.
We have a much younger population than many other countries, for example, European countries, so that's in our favour. But unfortunately, we also have the unknowns of HIV infection, tuberculosis, and we don't yet know how those conditions are going to act in the presence of a COVID outbreak.
So is the worst yet to come?
Absolutely, yes. Our tsunami is still coming.
I fully agree with Karen. We are going to see more and more cases. Our concern from the hospital environment is that we know that 15 to 20% of patients will need hospitalization. And will we have the beds available to accommodate those patients? And that's what we have been trying to prepare ourselves for during the last 2 months.
As the outbreak spreads in poorer communities, it poses several challenges: physical distancing and quarantining, as well as a lack of understanding about the virus and fears of ostracization.
What this pandemic has reminded us of is that many of the aspects around our impoverished communities are absolutely fundamental and may well have mitigated some of the effects that we're seeing now if they'd been in place before the pandemic struck.
Once the lockdown is lifted, medical experts are proposing staggered shifts for employees and a ban on big gatherings to curb the further rapid spread of COVID-19 in impoverished areas. Lindsay Dentlinger, Cape Town.